Hello, my name is Ghada. In this presentation, we will talk about auditory nerve that is responsible to sense of hearing. Firstly, we will discuss the anatomy of auditory nerve. It extends from cochlea in the inner ear and reaches the brain stem. It exits through a bone on the side of the skull called temporal bone. It is often called cochlear nerve, and it is a part with vestibular neuron of the eighth cranial nerve. But if we look at the auditory pathway, the information travels from receptors in organ of corti of the inner ear to the central nervous system carried by vestibulocochlear nerve. This pathway ultimately reaches the primary auditory cortex of conscious perception. In addition, unconscious processing of auditory information occurs in parallel. This pathway has two main components. Primary pathway or limnoscal. This is the main pathway through which auditory information reaches the auditory cortex, and non-limnoscal pathway which is mediating unconscious perception such as attention, emotional response, and auditory reflexes. The primary pathway contains a spiral ganglion, which is houses of cell bodies of the first order neurons. These neurons receive information from hair cells in the organ of corti and travel within a serous spiral lamina. Their central axon form the main component of the cochlear nerve. The vestibular nerve joins the cochlear nerve entering the internal acoustic meatus, and from this point outward, they are collectively called vestibulocochlear nerve. The nerves enter cranium through the internal acoustic meatus and travel a short distance, around 1 centimeter, to enter the brainstem at the cerebellopontine angle. Fibers from cochlear nerve bifurcate and information is sent to the cochlear nuclei, where the synapses of the first order neurons are located on each side of the brainstem. These two cochlear nuclei are anterior cochlear nucleus, located in the area where the nerve enters the brainstem, and posterior cochlear nucleus, located posterior to the inferior cerebellar peduncles. In general, in both the anterior and posterior nuclei, some fibers desiccate while others do not. For that reason, information from both ears travels bilaterally in each lateral lemniscus. This is important because supranuclear lesion will not lead to serious hearing impairments. Therefore, hearing problem can be conductive or sensorineural but are rarely central. The auditory nerve contains over 30,000 sensory fibers, and it's about 1 inch in length. But regarding the cross-sectional area, it has a range from 0.84 to 1.36 millimeters squared, as shown in the table below. In the normal hearing, the process begins by collecting sound waves from the outside through the pinna. These waves lead to vibration in the eardrum, and these vibrations are transmitted to the middle ear to move the pons. This motion stimulates the cochlear nerve cells to form synaptic connection with the hair cells. Then the hair cells convert the sound vibration to the electrochemical signals. These signals are transmitted to the brainstem via cochlear nerve, which is then transmitted to the auditory cortex, where they are interpreted and heard. In some cases, all or part of the hearing may be lost, even though the inner ear has successfully detected sound. This is called neuropathy, and there are several causes. Firstly, damage in inner ear hair cell that's responsible for stimulation the auditory nerve, or damage in auditory nerve itself, and in some time having genetic mutations. Now, to compare between the signal transmitted by normal nerve and defected nerve, note this figure. In the second sketch, the neuropathy caused delay in signals, but in last sketch, there is signal loss from some nerves. In case of the inner ear hair cell causes hearing loss, it will be good if we replace it with the artificial stimulation device. This device is a cochlear implant. The cochlear implants convert sound into electrical signal of the type that the inner ear produces in response to sound entering the ear. The electrical signal is transmitted wirelessly to the electrode surgically implanted in the inner ear. The signals applied to electrodes stimulate the auditory nerve to produce the sensation of sound. Now, what is the parts of cochlear implant? Firstly, we have a microphone which picks up sound from the outside, and we have a speech processor which selects and arranges sound picked by the microphone. And we have a transmitter and receiver stimulator which receive signal from the speech processor and convert them into electrical impulses. Finally, we have electrode arrays, which is a group of electrodes that collect the impulses from the stimulator and send them into different regions of the auditory nerve. Thank you for listening.